Hi heroes, Denise here. Today's How to Boost Your Immune System tidbit is about taming the viruses to go from wild to mild. Think of it as a lion versus a domestic cat. As a respiratory therapist, I've had people say, I know people who get the flu even after getting the flu shot. And you can substitute COVID or pneumonia in that sentence. I'd like to point out the goal of vaccines is not necessarily to prevent you from ever getting sick, although wouldn't that be nice, but to reduce the severity of the illness, therefore reducing hospitalizations and deaths from the flu, COVID, and pneumonia. Vaccines are meant to help your body build up an immunity, so when it gets exposed to these viruses, it recognizes the virus and fights back, giving you milder symptoms and less downtime in bed or on the couch. Now, a virus's goal is to survive and make you sick. To do this, they mutate or change, so once we get vaccinated or sick with a certain strain, the virus changes so it can make us sick again. Like the disguise in the commercials where the flu virus is in the wolf costume saying he's just the flu. This is why we get flu shots every year and are beginning to get COVID shots once a year too. So our immune systems are ready for the predicted strains of those viruses that are out there each year. So, how do they decide which strains to include in the vaccines each year? Why aren't they 100% effective? Glad you asked. The World Health Organization, or WHO as it is known, and the Food and Drug Administration, or FDA, look at what strains of the flu occurred in Australia in July and August, which was their winter season. The US is expected to see similar strains. Most of the time this is accurate, but some years it's not, and then the flu shot is only 40 to 50% effective. Remember, some effectiveness is better than no effectiveness, which is what happens when people choose not to get vaccinated. Generally, vaccines are especially important for those with asthma and COPD, as we, myself as well as the co-founder of Nightingale, Sharon, are included in that category and are at a higher risk for serious complications from the flu, COVID, and pneumonia. In addition to the flu and COVID, respiratory syncytial virus, or RSV, and whooping cough, or its medical name is pertussis, are also spread through the air we breathe. By the way, we have vaccines for those too. Now, there are rare exceptions of people who have had life-threatening reactions to vaccines in the past and should not get them. Today's tip is it's a good time of year to talk to your healthcare provider about which vaccines are important for you to get your immune system ready for the battle with the viruses this winter. This ends our tidbit series on boosting immunity. Hope you picked up a tidbit or two to keep you healthier in 2024. Bye for now.